Hi, and welcome to another episode of One Clear Vision. I'm Dr. Sophia Capo. I'm a residency-trained optometrist. That means I've done an extra year of school in pediatrics and vision rehabilitation. Today, I am super excited because I am joined by a friend and colleague, Dr. Taryn Fay-McClymont. Welcome.
Thank you.
Dr. Taryn is a pediatric neuropsychologist, and you're going to tell us what that means, but she brings a ton of experience. She previously worked in Calgary at Children's Hospital, and now she has a private practice here in Kelowna. So, Taryn, can you please tell us what is a pediatric neuropsychologist?
Yes. So
Start with that.
Thank you for inviting me to this. So a pediatric neuropsychologist is a clinical psychologist. So in British Columbia, psychologists go through a number of levels of training, which includes a bachelor's degree at university, a master's degree, and then a PhD. And that PhD includes clinical practica. To finish with the PhD, you do a year residency before you're then apply to be registered. A pediatric neuropsychologist does very similar training, so generalist training. My focus was in pediatrics or children. And then we do a postdoctoral fellowship, which is another 2 years of training, usually based in a hospital.
Okay, so that's undergrad, master's degree, PhD, which included a residency, plus a 2-year fellowship.
That's correct. Yes.
Okay.
Yes.
How is that different from other psychologists that we may see, or a school psychologist or psychotherapists? Like, there's so many different terms in the psychology world. Like, can you help us understand and break those down?
Yeah, that's a great question. So the main difference is that we're education in terms of that brain behavior relationship. So some of that education includes neuroanatomy, neurophysiology. We're looking at really acute medical conditions like brain injury, stroke, cancer, brain tumors, leukemia, and seeing how each of those affect the brain. And not only how they affect the brain, but how we can help children rehabilitate afterwards, and the impact on their lives, how we can get them back to normal. So there's that additional piece of expertise in terms of that brain behavior relationships. And that, in terms of a medical setting, that's really helpful in terms of seeing really complex kiddos. But we also have training in complex neurodevelopmental conditions, sometimes like autism, developmental disabilities. And also as what I'm doing here is really, I'm very pleased to see kids who are developing regularly and just helping their parents and them understand how they learn best.
Okay, so then if we're breaking down, because I know you were doing very different assessments at Children's Hospital just because of the type of kids that you were seeing there.
That's right.
So like, what types of assessments do you do specifically here in Kelowna at your private practice?
Yeah, so I see any child whose parents want to come see me. So I see really 3 types of assessments. Generally speaking, parents come to me when their children are having trouble with learning. So are they having trouble learning to read or write? They're having trouble with math. They're having trouble with attention. So the teacher's saying, if they could just pay attention better, they would do so much better. Or they've had something in development or early on in their medical history that has changed the course of how they learn. And so they will come to me and we'll talk to the parents. I'll talk to the parents and say, what are your concerns? And if their concerns are, they're just not learning how to read as well as they should, teachers are coming to me with concerns, then we'll talk about something called a psychoeducational assessment. So that assessment includes assessment of all academic functions. So how do you learn, how do you read, write, do math? Also, how well do you pay attention? And then all psychoeducational assessments have a piece that's looking at intellectual functioning. And the reason we do that is we want to see what are their capabilities of learning. That's a really regular thing that teachers talk about.
So like academics versus then like, are you able to read? Are you able to actually learn? But
That's
then
right.
What's your intelligence kind of built into that?
That's right.
Can you explain? So I know, because in working with kids, like a lot of the things I have to do are very objective.
Right.
Because children sometimes will fib or they'll give the wrong answer on purpose. Like, how do you make sure that you're actually getting the right answer from these children? Like, how do you know that these tests are accurate?
Yeah. So we have embedded effort tests. So we actually sneak in some of the tests to see how well they're trying.
That's funny, the effort test.
Yeah, so we do tests with them that we know in any situation that kids would be able to pass with no problem. And so we sneak those tests in.
Can you give an example of one of those tests?
Yeah, so an example is it looks like a memory test. It's picture-based, so we're just showing them one picture every few seconds, and we can show them up to 50 pictures. Our picture-based memory in humans is incredible. Hundreds of pictures we can remember and recall, even though we don't think we can. So we'll show them 50 pictures, and then we'll say, after we finish showing 50 pictures, pick the one I just showed you. Most kids get 50 out of 50.
Wow.
Most adults. And this is most kids also with developmental disabilities. So we know we've used these tests in children's hospitals. We'll see all sorts of kiddos, and we know that they pass unless they're really not trying or there's something else going on where they're not engaged. And so there's those tests, but there's also we work one-on-one with the kids. And so if we see that they're not giving their best effort, or they're really anxious, or something's going on, they're in tears, or they need their parent beside them, we do all of those things to make them feel better. We also use, as you do, lots of prizes and stickers and toys that they
a little bit of bribery here and there.
That's right, to get them engaged. So usually, I'd say 99% of the time we get kids want to please adults most of the time, and they give their best effort. And in the times that they don't, then we either do it another day, or we get them a snack, or do something to help them regulate. Yeah.
Okay, that's good to know, because I guess sometimes these assessments, like how long is a typical assessment that you're looking at?
Yeah, so we haven't talked about the neuropsych assessment, but the psychoed assessment is probably the most regular ones I do. We generally start about 9:30. We meet with the parents, have a little chat, get started around 10 a.m. for testing, and then we do an hour and a half to 2 hours, and then take a lunch break, and then we might do an hour afterwards. So in the grand scheme of things, it's about 3 hours
of testing, depending on how many breaks you're throwing in there.
Yeah, but I usually just book the whole day, because if we see littler kids or kids that need extra breaks because of inattention, or they need to run around the building a little bit, then we put those in.
You build those in. So what's the youngest patient you'll see, and then the oldest patient?
So my focus here is on school age. So in Alberta, at Alberta Children's, I would see as young as toddler. But here it's age 6 all the way up to 25. So young adults. Okay. So that's the range that I'm seeing here. And it seems to be, there's a couple of reasons for that, but when I came to Kelowna, it seems, and I just came last year, it seems to be the biggest age gap in terms of kids that need assessments and aren't getting them.
Okay. So you just like filled the gap in the community. Like that's what was needed, and that's what you're here to do. Yeah. Well, we're happy that you're here, because I know
Thank you.
Besides like Vancouver and Calgary, I think you're the only person in between and the entire interior with that training. So
yes,
we're excited to have you here, because the children definitely need these types of assessments. So the psych ed assessment that you do, how is that different from like a school psychologist?
Yeah, so that's a great question. So a school psychologist actually will do very similar things in terms of a psychoeducational assessment. The difference is because it's within the schools, they have a limited budget and limited funds and time to do these assessments. So I do a little bit extra in terms of looking at ADHD as well, whether that's a diagnosis within the psychoeducational assessment. So that might be a tiny bit different. I also look at emotional and behavioral functioning. Because we all want to see if especially teens are struggling with depression or anxiety, and that might explain learning difficulties.
Gotcha.
So I do a little bit extra, but within the school system, they do an assessment of intellectual functioning and academic functioning as well. I hear from parents, and this was the same in Calgary, is just the wait lists are very long. And they also only take the kids that are struggling the most. So sometimes when you've got kids that are in the gray area of, they're just not achieving to their potential, or parents are worried, teachers aren't worried, that's when, it's good to see if there's other options.
Gotcha. So that's kind of the difference between the public system, which would be, funded by the school, but a little bit more limited in their testing.
That's right.
And then the private system, you can, like you're saying, book off a whole day just to see one child. So you'll make sure that you get all the testing done, whatever the child needs to get through that test, so you get the most accurate
That's right.
testing.
Right. And we also have the time to spend with parents and get extra questionnaires and really do kind of like a full checkup.
Gotcha. Yeah. Are you making the diagnosis, or do you just present the testing and then that goes to, I don't know, a pediatrician
these are such
or
good
something?
questions. Yes. So I'm making the diagnosis.
Okay.
So the diagnoses that come from a psychoeducational assessment are ruling in or out ADHD, and we can talk a little bit about that, or learning disability. Right? Or looking at mental health diagnoses like anxiety or depression or other diagnoses. Or on a rare occasion, intellectual functioning. So you can either have low intellectual functioning, which is intellectual disability, or really high intellectual functioning, which is in the range of giftedness or high IQ.
Okay, interesting. So not only children who are struggling, but you'll see children who are almost like exceptionally high achieving. Yeah.
And actually, those kids present sometimes as struggling in school, because what happens is that school is so easy for them, or there's aspects of school that they're bored with. And so that boredom, sometimes when parents come in and say like, they're really smart, they've been reading since they were 3 or 4, but they're just not achieving to their potential in school. And teachers are saying they maybe have ADHD. That's something I look at, is giftedness can sometimes look like ADHD, because that boredom leads to disengagement.
Interesting.
And that can look like inattention.
So then are you working with like because I know your focus is not necessarily just on diagnosis, but it's getting these children the supports that they need so that they can successfully learn and grow in school and in other areas. So what's kind of like, are you working with pediatricians? Are you working with like what other professionals are needed in order to like really help support this child? Or like the teachers, I guess, in the school, like who are you communicating with?
Well, I mean, in ideal world, that team would include teachers, school professionals, pediatricians, family doctor, any other type of specialist, including you, to kind of form that team of how do we help this child be the best they can be. That also might include other psychologists or counselors. So when I do the assessment, what comes from that is recommendations. So those recommendations within the report are extra support in school, usually in the form of an individual education plan or an IEP. Extra support in terms of emotional behavioral functioning. So if we're looking at anxiety or depression, visiting the family doctor and making sure that there's nothing else going on. Counseling or therapy support, psychology support, and then also parent resources. So what can the parents do to change how they're operating at home? And then tutoring, right? So there's so many things that we can do. And then also what can we teach the child to be more resilient and to help them understand what they need to learn about in order to function best. And so those recommendations are all part of the report. And the idea is that this report is kind of like their document, the parents' document to access all of these pieces. So that report often goes to pediatricians, family doctors, school. And then I try to set them up with providers within Kelowna that I know have space and time to see the kids.
Gotcha.
Yeah.
So clinical psychology, what you do. So you do some parent coaching, but you won't actually do like counseling with the child. That's
so I can. So I'm trained in that.
Gotcha.
So it's kind of like medical school where you have the generalist training. So my PhD and in terms of my residency, even into my postdoc, included cognitive behavioral therapy for anxiety and depression and adjustment therapy. But just in terms of timing, I don't have the time to open it up to that right now. And so I am focused mostly on, 90% assessments and a little bit of parent training.
Gotcha. I guess because there are other providers in the community who can also do, those types of like anxiety, depression treatments, but not a lot that have your training in terms of the broad assessments.
That's right.
Okay. Yeah. So you kind of just focused on that.
Yeah.
On that area.
Yeah.
What is the wait time for an assessment with you? What's the cost of an assessment?
Yeah, so these are great questions. So we kind of talked a little bit about the public versus private. So I was in the public system at Alberta Children's for 15 years. And one thing we found, there's a couple of reasons I moved back to Kelowna. One is family, and I grew up here. But the other reason is that post-COVID, I think what happened to the healthcare systems is we all got really backed up in terms of our wait lists and our times to see patients. And so we were looking at a year plus wait list for assessments within the hospital. And these are kids with medical conditions. And so it got to a point where it was hard to manage. And so one of the ideas of coming into private practice is seeing kids when they need it. Gotcha. And that's one of my goals. And so I don't want a long wait list. So right now I'm seeing kids usually within 2 months of parents contacting me, sometimes
that's
sooner.
Excellent for the Okanagan area.
Yeah, and that's my hope, is to keep it like that as we go forward. So I think when you're talking about child development, if you have a 6-year-old kiddo that's really struggling, if they have to wait till they're 7, they've already lost a year of learning. And so the hope is to see them sooner than later and get them kind of figured out and ready to start with the extra interventions.
Awesome.
Yeah. And cost. Sorry.
Oh yes, yeah. Cost. How much is it?
So cost is another issue. So in the public system, so there is neuropsychologists at BC Children's Hospital and Alberta Children's, and so those and psychologists within our system, so our interior healthcare system, and so all of those assessments are funded by the government. There's also interior health assessment network, so ICANN. And those are funded too, but those also come along with long wait lists. So some parents choose to do a private assessment because of the speed and efficiency as well. And so the assessments for the psychoeds range, they're close to $3,000. And for the neuropsychological, they're $3,500. And for the ADHD assessments, which is just the check-in on whether or not they meet criteria for ADHD, is $1,000.
Is $1,000.
Yeah.
Okay.
And they're covered usually by extended benefits.
Oh, perfect. So if someone has like benefits through work, it can be run through there a lot of the time too.
Yeah. So most of the time they can run it through. So when we see the child on the one-to-one, that goes under the child. And then I also do lots of interviewing and questionnaires with the parents and feedback. And so those are psychology sessions with the parents.
Awesome.
Yeah.
Okay. So there is like that, there is kind of some funding available in those cases.
Yeah.
And I know you said that even like if there's an ICBC accident or something like that for a kid within the ranges you do, it can also be funded like in those cases.
Yeah. Yeah. There's a funding for children with brain injuries through BC government. ICBC is separate. There's a number of other variety programs that will fund assessments as well.
Cool. So you're private, but then also work with some governments.
Absolutely. Yeah.
But just you can't be funded by the full government because then the wait times would be too long.
That's right. Yeah.
Okay. Let's get into the fun stuff, because I think this is what a lot of parents, and even me, like I'm interested in understanding. Can you just give an overview, because you're like the expert in this. What is ADHD? Does my child have ADHD? I think is what a lot of people do. I have ADHD. What is ADHD?
So ADHD is attention deficit hyperactivity disorder. Now, what's happened over many years is that they've changed the name. So a lot of people will say, well, ADD. What is ADD and how is that different from ADHD? ADD is the terminology that was used by the profession years ago.
Okay.
And it's the same thing. So it used to be called ADD, attention deficit disorder, with or without hyperactivity.
Okay.
And just to make it a little bit more confusing, they then changed it to ADHD, predominantly inattentive types. There's 3 types. There's a type that you're mostly inattentive, you don't have the hyperactivity, impulsivity. So that's called ADHD-I, inattentive type. There's an ADHD that's hyperactive, impulsive only, which is very rare. We don't see that very often. And then the most common is ADHD combined type, which is ADHD. So you've got the attention deficit, you've also have the hyperactivity, impulsivity. And that's the most common. How do you get ADHD? ADHD is genetic, usually. So when I diagnose ADHD in a child, it's quite likely that one of the parents has struggled with attention difficulties throughout their life and maybe has not been identified or it's been more mild.
Okay.
And then you can actually come to ADHD from different types of brain injury as well. So we often saw ADHD as a result of intensive chemotherapies.
Interesting.
Or ADHD secondary to a brain injury or secondary to epilepsy.
Does a brain injury, does concussion count in that? I know concussions are more mild. Not
usually. Yeah, concussions are more mild, and the majority of kids recover usually within a week to 2 weeks. Okay. And then a rare few take a few more months. But it's pretty unlikely that ADHD would come from a concussion. You need a pretty significant brain injury to result in a diagnosis of
And
ADHD.
Is it rare to have ADHD without a parent having ADHD as well?
Sometimes we look at other genetic factors, like there can be a relative or a number of relatives with ADHD. So and sometimes ADHD is identified and we're like, we don't know where this came from, because both parents are saying like, we don't have any problems with this. So sometimes we don't know. But the majority of times I'll in feedback, which is after the assessment, I'll be talking to the parents and, the wife will say like, I'm pretty sure my husband has some attention difficulties.
Interesting.
So that's one of the diagnoses that are fairly typical, and most families that are coming in that are querying ADHD are usually correct, and that this is what they think it is.
Interesting.
Yeah.
So all of those kind of things that we see sometimes online with like screen time and, giving your kid like immediate reinforcement and immediate like satisfaction, gratification with screens, that's not causing ADHD.
Yeah, that's such a good question. So I think, this is the broader topic of why I'm doing parenting support. And I'm a parent myself. There's so much pressure to be perfect as a parent. And they're like, if you do this, you might equal this, and don't do this. And I think, everything in moderation. I think, the less screen time, the better. But as a parent, I understand how this works, right? I've got a 10 and a 12-year-old. You're not going to cause ADHD by giving your child screen time. So ADHD is a diagnosis that's having a significant impact on their day-to-day functioning. And it's not something that you can cause by your parenting style.
Okay.
We can talk about behavior and, parenting styles, but I think, there's a lot of fear in parents about like, if I do this wrong, this is going to happen. And I think my message to most parents is your child's doing great. Kids are really resilient. It's really hard to cause damage or to change the course of their functioning by doing something wrong.
Interesting. Okay, that's good to know. I feel like that's a fear that I don't even have kids, but I feel like it's a fear that I already have. Let's talk about autism. Can you just give a very general overview of like what is autism?
Yeah. So autism is a deficit in social emotional communication, really. So social emotional reciprocity. So what you're looking at is the child interacting with others at an age appropriate level, and they're able to respond to social interaction. And so some people talk about eye contact. That's probably the easiest to see, but you can also have eye contact and have autism. You can learn some of these things. So autism is a developmental disorder, meaning that it appears early on and is usually picked up in toddler years. And it causes a differential development. And there's a couple levels of autism. There's a more severe level that is pretty characteristic of what we think of autism, but there's also a higher functioning autism that comes along with normal or high IQ. But always the commonality is that social emotional deficit. So they have trouble maintaining peer relationships and engaging peers in the same way. They might do better with adults than peers. And so autism is something that is identified early on, usually before age 6. And it's something that through the BC government requires a very specific type of assessment.
Okay. And is it usually identified in girls and boys under that age? Because I've heard, it's easier to miss an autism diagnosis in a girl.
Yeah, I think generally speaking, it's easier to miss a lot of those social emotional diagnoses in girls because girls are pretty adaptive in terms of how they respond socially, and they can look, compared to a boy that has poor social skills, they can look pretty good. And so I think, even when we diagnose ADHD in girls, it's at a more severe level because it's harder to pick up. And I think, we can talk about how things have been done for many years, but I think, a lot of the research and a lot of the ways things have been done has really focused on male development for a long time. Yes. And so, I think we're starting to equalize the field a little bit and say, no, this is how it looks in girls. And in terms of autism, because there's in terms of the BC government, in order to get funding really in children, there's a set of assessments that need to be done, and they're called the ADOS and ADIR, which isn't important, but it just means that it's hours long of assessments that are specific to autism. And the BC government requires that those be done in order to access funding. So access the diagnosis and funding. And so that's something that there's a lot of psychologists in Kelowna that do that. And so that's something that I'm not doing within my clinic. However, sometimes parents are like, I don't know what's going on. There's something going on. Teachers have, sometimes said autism, sometimes said ADHD. We're really worried and we don't know what. I will get them, and I just had a recent one, to fill out a whole bunch of questionnaires before they come. We'll have a chat, and I'll, before we see them for the assessment, I'll be like, I think this might be autism and you should go this direction. Or I'm not sure what this is. Let's see your kiddo. And if I think a better explanation for what's going on is autism, then I will tell you what to do with that afterwards.
Interesting.
Yeah.
Because there might be autism with something else, or autism, or just maybe it's not very, very severe and it's not obvious.
Yeah. And autism can have comorbid diagnosis. So you can have anxiety, you can have intellectual disability, you can actually have ADHD and autism as well. So it is a complexity. Okay. But I think, I always go back to human beings are complex, and children even more complex, because children can be a little bit strange and funny at times, right? So sometimes it's just like, let's see and let's figure out what's going on. If there is a history of developmental concerns, so they're slow to develop language or walk, or, there's concerns from a social perspective early on, then I will do a more thorough assessment, which is a neuropsychological assessment, which is that extra level of testing in order to figure out what's going on.
Okay. So then if, let's say, a child is struggling with learning at school, they don't have ADHD, they don't have autism. Yeah. Let's say they don't have anxiety and depression. Yeah. Can you talk about some of the other learning disabilities that might exist, or might even be more common? I don't know. You can let us know than those other things, but maybe we kind of confuse all of them together.
Right. So when we talk about learning disabilities, there's three general types of learning disabilities. So there's learning disability in reading, which is the most common. Everybody knows that. It's usually identified between ages of 5 to 7. And the other name for a learning disability in reading is dyslexia. Dyslexia is the most common name that we know. It really comes from the Latin term. So dys means not, or you can't, and lexia is read. And so dyslexia is a fancy name for reading learning disability, but they're the same thing, and they have the same treatment.
So just a disability as in not being able to read. So dyslexia doesn't mean my child is reversing their letters, or my child switches the back, or reads backwards, or writes backwards. It means that there's some sort of a disability in reading. That's all that means, general term.
Yeah. So we actually think, from a neuroanatomical basis that there's different networks acting in different ways in terms of how those kids learn to read. And that's usually genetic based. So we often see learning disabilities passed down in families. It can sometimes go along with ADHD. Dyslexia is the most common genetic learning disability. So often in kids that are having trouble, parents also said they had some trouble. In terms of the switching letters and those kind of things, that can be a symptom, but we see that in all kids when they're learning to read, because learning to read is a symbol sound association, right? So we're seeing a letter A and we're learning what it stands for, and everybody's learning that. And so switching letters that looks the same is really common when you're learning a new language. And so that eventually what happens in a regular development is that kind of phases out, and kids learn what a D and a B look like and what they sound like. Kids with dyslexia will have more trouble associating that sound with each letter, what they see.
So then a treatment for dyslexia would be what?
So the evidence-based intervention is learning phonetic decoding, phonological processing. So it's something called Orton-Gillingham. There's a type of learning intervention that's evidence-based. And tutoring, there's a lot of Orton-Gillingham-based tutors or something similar. And a lot of schools use very similar methodologies to teach these kids. The trick is that with a really severe dyslexia, we need lots of attention on that intervention. So daily for extended periods. And so sometimes the school systems don't have the amount of time needed.
Gotcha.
But the other piece of identifying the learning disability within the school system is then getting extra interventions. So extra time, one-to-one support, extra teacher attention, kind of pull out learning, those kind of things. And also looking for frustration and disengagement, and seeing that as a sign of difficulty learning rather than behavior.
So these assessments that you do are incredibly important, not because we want to put a child and give them a diagnosis and put them into a category, but
Absolutely.
because funding for autism, funding for like things like PT and OT, like physical therapy, occupational therapy, speech and language pathology, one-to-one support in the school, getting an individual education plan. Children don't have access to those things unless they have an assessment by a professional with a similar title to you. Unless they give them those kind of that paperwork. Is that correct?
So that diagnosis opens up the next level. So diagnoses are not just for labeling kids. So I would only use a diagnosis if I think it's the best explanation for the difficulties that the kiddo's having. And that diagnosis then opens up a treatment plan, really, and also funding. So when we look at diagnosing ADHD and learning disabilities, parents can also apply for a disability tax credit. And so that's a yearly write-off in terms of they can write off things like tutoring or other things that they have to pay for to support their child. And so there is that those diagnoses open up the next level of supports and also give you a pathway to what kind of supports would meet your child's needs the best.
And then in school, we know that there's the public kind of system for autism and there's a public system for ADHD. Is there a public system for diagnosing learning disabilities as well? Like something like dyslexia?
So that's the school system.
So that the school system also looks at diagnosing those things as well. And the wait times for that are?
Depending on the school district, and also, depending on only the kids that are struggling the most get put on the list because there's just not enough psychologists within school districts. But I think the wait time can be significantly longer than in private practice.
Okay.
Yeah. And then, so there's two other types of learning disabilities that I'll just touch on. One is written language learning disability or writing, and that includes spelling and punctuation and capitalization. And as the Latin name for that is dysgraphia. So you can't write, dysgraphia. But that's a fancy name for written language or writing learning disability. And that sometimes goes along with reading learning disability, because if you can't read and you don't know your letters, you're also going to have trouble writing them. And then the third one is math learning disability. And so the fancy name for that is dyscalculia. And a math learning disability is really trouble with learning and understanding how numbers relate to each other, and also, the basis of addition and subtraction and multiplication and division. So the trick is that all kids struggle with any of these new pieces of learning at an early age because they've never learned them before. So math struggles are common, but it's not only the math struggles, but it's math struggles, but then they're not learning at the same rate as other kids, despite the same education.
Yes.
And so that's the difference. So when we talk about what is regular and what is disorder, there's a big distinction between, some anxiety, kids worry, parents worry, not being able to sleep because I'm worried about the house burning down. Those are normal things that everybody worries about. So there's a piece to talking about normal versus disorder. Disorder is when it's interfering with your ability to live every day, ability to go to school, ability to achieve, ability to work. That's when we talk about, this is at the level of a diagnosis that we need to figure something out.
Gotcha. So if someone comes to you and they might have some of the characteristics, but it's not necessarily affecting their function. That's right. That's not considered a disorder.
That's right. Yeah.
Okay.
Yeah.
Very
so we talk to parents, we talk to teachers, and we say, okay, with a kiddo, is it interfering with their ability to learn? Are they able to sit in the classroom? Are they achieving at the same level? And if the answers to all of these are like, yeah, there's no problem, and the parents said, everything's great at home, we're not seeing a lot of things, we have some anxiety, there's no, after testing, there's no diagnosis with that, but I can still give tips and tricks to the parents to help them, figure out some of these difficult parenting situations, because parenting is tough at best.
Hard.
Yeah.
So I think that's why your assessments are so cool, and which is why I love everything that you're doing, because
Thank you.
You know so much about like all of these disorders, like every single one, because you've seen and diagnosed so many with your years of experience, that it's not just, oh, like this kid has the signs of ADHD, let's run down the ADHD path. It's no, well, maybe there's a little bit of that, but it's not fully that, and it might be something else. So I think that's a huge perk to say, like, because you get to spend the extra time and you get to talk to the parents more and you get to do all of those, you know, it's a more comprehensive type of assessment that you're able to provide. Unfortunately, it being a private service, but fortunately that they're getting an exceptional assessment and exceptional care.
Oh, thank you.
I want to talk about how this, kind of like how we met, basically, because how vision plays a role in, you know, these types of assessments. So can you tell me how much of the assessment would you say is visual?
Yeah. So any assessment that we do is pretty much half visual, so visually based, picture based, and half verbal. So talking, asking questions. So when you think about visual reading, actually you're reading words, that's visual, but we also do picture based testing. And then verbal is really like, tell me what this word means, or how do these words relate, or, remember this. So everything that we do tests both visual and verbal because we're looking at both hemispheres in terms of the brain. Gotcha. And I think this is where I'm really interested in the vision piece, because this is how we got into this and met, is that Dr. Capo was like, well, how much of this involves vision, and what about, you know, when the eyes aren't working properly, do you know that that's a good explanation for why they can't read? And my answer was like, I don't know that. And I thought this is something that I haven't really been trained in and haven't thought about. So we talked about reading difficulties and how that can relate to vision. So
yeah. When I've talked about this in other episodes as well, specifically our eye coordination episode, children reading is a very complex task. It's a very coordinated movement. And I'm talking about not how the brain works and how the brain has to process that information, excuse me, but simply just how the eyes need to align and how they need to focus in order to pick up that information clearly and see it as single. Because there has been, you know, a ton of people who I have seen who are going through the ADHD testing or other learning disability testing, and no one has asked them, like, do you see double? Are the words, you know, sometimes blurry and sometimes clear? You know, do you get a headache after you read for, you know, longer than 20 or 30 minutes? Because you mentioned that the testing, like if we have a test for, let's say, the most basic testing that you have, which will last a few hours at minimum, but usually more than that because we give the child breaks and we have different talks, or just the cooperation takes a little bit longer. That's hours of time doing a visual task, a sustained visual task. And so how important is it, do you think, like how can pediatric optometry play a role in, you know, the psychoeducation assessments? Or like when should they have a vision assessment? Is that after they see someone like you or before?
Yeah, I think that's a great question. And you provided me with a number of questions I can ask about, do you see two things, or do you see something very clearly, and do you get headaches? And that has led me into this pathway of thinking about, you know, if I am diagnosing or they do have trouble with reading, has their vision been tested? And so a common question that we would ask is, have you had vision tests? Have you had your hearing checked? And the answer is yes. And just from a parenting perspective, from my own perspective, so I've got 2 kiddos, and my 10-year-old has had vision tests every year of her life. And she's now 10, and has always complained of, you know, some headaches, doesn't love to read. And so I mentioned this to Dr. Capo. We brought her in. Sure enough, she has glasses now, and totally unexpected. And she said to me the other day, if I wear my glasses, I don't get headaches. And this was groundbreaking for me, because I thought, okay, for all the kids that I have diagnosed learning disabilities or reading difficulties, or they complain of headaches, have they had this test done? Yeah. And so maybe you can explain why this is different than every other. So she said 9 years of optometry tests, 20/20 vision, no problem. And then I brought her to Dr. Capo, and
she needed glasses.
And she needed glasses.
So vision is a whole lot more than seeing 20/20. So 20/20 is just a measure of clarity. Remember, it's just how well can we see? Can you see what the average person can see from 20 feet away? If that answer is yes, you have 20/20 vision. But 20/20 clarity tells us nothing about how the system is focusing, how it's aligning, and what the stamina is like. So in the case with your daughter, she had 20/20 vision. Her clarity was really great. But when I measured her eye alignment and her eye focusing, I could tell that her eyes were overworking. Okay, completely different measurement. So her focusing system, the system that should turn on when we look up close and turn off when we look far away, same system that, when we know someone over 40 who's trying to look up close and needs reading glasses, but kids should have a really strong and really regular focusing system. When she's looking up close to see something, her system was actually on overdrive, and it was on overdrive all the time. And we know that children who have focusing systems that work too hard tend to get headaches when they read. And so when I was able to do that measurement and say, okay, this child is overworking up close, you also have headaches and you hate reading, let's just see if this really simple solution, like a pair of glasses, can help relieve that strain on the system. And I have to make sure, and it's always really difficult because when you tell the child to wear the glasses, it's not going to be you put them on, oh my goodness, now I can see, because they already see clearly. It's right. When you put them on, it's now my eyes don't have to work as hard to see. And then it's, oh, well, now when I read with my glasses on, I don't get headaches anymore. Well, reading can be way more enjoyable if you're not getting a headache after 20 minutes. And so it's incredibly important. And I was only able to find that diagnosis by doing those additional tests that I was trained to do in the pediatrics world. And that includes putting eye drops in the child's eyes to relax their focusing system, to measure any hidden prescriptions, which a lot of the times isn't included in a general optometry routine exam. And so it's important, especially when they're being investigated and our wait lists are very long, and so many children are struggling in school. Let's just rule out a vision problem. Let's just make sure that there's not a hidden prescription, there's not an over focusing, because if there is, we want to remove that barrier. But I think it's important to do a vision test before a psychoeducation assessment, because what if they're doing your assessment with their glasses on? Maybe they'll score better. Maybe they'll have better attention.
When and they might not get headaches, right? So there's so many pieces, if they're booking with me, I think that is a really great thing to do before they come, and to rule that in or out. And then at least we can, in terms of ruling things out, all of us do a little bit of a checklist, right? It's not this, it's not this, it's not this. And so when I say, have you had your vision tested? I don't mean,
have you had a screen? Do you have 20/20 clarity?
That's right. Have you seen Dr. Capo? I think my new question is, have you seen Dr. Capo?
Yeah, that would be awesome. And I want to clarify that vision conditions do not cover up learning disabilities either. So sometimes they can be correlated. And we know that children who have ADHD or children who have dyslexia, reading disability, tend to have higher glasses prescriptions or hidden glasses prescriptions. They tend to have difficulty with their eye coordination. But that doesn't mean that the eye coordination problem is causing the ADHD. It doesn't mean the eye coordination problem is causing the learning disability. But these are small barriers that I think, again, our goal is not to put a diagnosis on a child and say, this is something that's wrong. Our goal is to remove the barriers and let them do what they need to do, in school. And so that's why, working together, if we can say, well, there's a vision problem and there's an attention problem, how do we want to manage that attention problem? That's where you would work with a pediatrician to maybe get a medication or different strategies in school. And I would say, well, let's remove the vision problem and see if that helps a little with the attention issue. So they're kind of, every single person on this team picks up a little piece of the puzzle. Because children, like you said, are very complex. And so it's not just one person who's going to solve the entire problem.
That's right. That's such an important piece, is to say, if they do need glasses, it's not going to solve the learning disability, but it's a piece of the puzzle that will enable this child to have more success in learning in school And those, and even reading at home, I think it's remarkable. As some parents would say, you know, my child won't wear glasses even if they get them. Well, when they don't get headaches, I haven't had to remind my daughter once to wear her glasses on. And she will, even at the end, you know, in bedtime, before bed now, if she starts reading, she'll say, oh, I forgot my glasses, and go get them and bring them to read before bed. And so it's pretty remarkable, the change. And this is only over the last month and a half, I think. Yeah.
And it was so simple.
Like
something so simple, so cost effective.
And easy. She enjoyed it. Dr. Capo has lots of games. You know, some parents worry about the eye drops, the dilation. She didn't even notice. You're so clever at putting them in. She didn't even notice they were in until afterwards. And I think it's a pretty simple thing to do, to try to figure out if there's another piece of the puzzle.
Yeah. Well, thank you so much for talking with us today. Is there anything else that you wanted to leave with the parents and people watching about neuropsychology or about assessments or parenting? Is there any other tips that you have for parents struggling out there?
Oh, I've got so many tips. I think in terms of the assessment type, even, you know, I talk to pediatricians or family docs or parents, people will say, I don't know which assessment to do for my child. So I do free 15-minute consults, their phone or video consults. Parents can just book them. They're usually within a couple days to the week. You can book with me and chat about your child for 15 minutes, and I can tell you what I think. Whether they need a certain type of assessment or, you know, parenting support, or what might be best based on my background and knowledge. So that's often a helpful way to figure out, what do we need? We're really struggling, but we're not sure what we need. And so also, as you get into young adulthood, I even have young adults book with me and for that 15-minute consult.
And you do that for free. You'll just talk to anybody.
I do.
Huh. Yeah. You're going to be booked up. I'm going to start booking appointments with you too, just to share my ideas.
It's just a nice way to get to know the community. And I think, you know, as I build my name here and network, I think it's a nice way to reach out and help parents that are struggling. Because I think sometimes as parents, we really worry and we're not sure what that means. We're not sure what to do with it. So I do that. And I think that is helpful so you don't have to figure out what you need. You just have to talk to me.
Just
first.
have to ask the questions.
Just have to ask
to the right
questions.
Professional who's going to answer the questions.
That's right. And if I can't, I'll refer you to somebody else.
And that's what's amazing in this line of work. And I find in the pediatrics line in general, anyone who's trained in pediatrics, we do it because we care genuinely about the kids, and we want them to do better. Yeah. And if I'm not the solution to that problem, I want to help that family find the person who's going to help them. Yeah. And so, book that 15-minute phone call. Talk to her about your child. She'll have some really, really great ideas for you, I'm sure.
Yeah. And we love kids. So that's another nice piece of being pediatric trained. We're kids at heart. So we've got lots of good toys and other things to keep them entertained.
That's amazing.
And then, you know, parent tips, I think it's just knowing that you're doing a great job. And I think the majority of parents that come to me for parent support, you know, if you're worried about being an imperfect parent, you're not the parents we worry about, generally speaking. And so I think, you know, in this world where there's a lot of fear about other things that are happening with your child or diagnoses, sitting with the fact that just because they have worries or times of sadness, that it's not a clinical diagnosis, that these are all parts of being human and they're normal. And I think the more we can communicate that to our kids, the healthier our kids will be. That's my soapbox.
That's her
for today.
Tidbit.
Yeah.
Well, thank you so much for joining us. Again, this is Dr. Taryn Fay-McClymont. She is a private practice here in Kelowna doing neuropsychology assessments and psychoeducation assessments. And thank you so much for being here.
Much.
Have a good rest of the day, everyone.
Thank you.